and we'll get it set up to go live on Facebook. And that's going live on Facebook is good because that makes it so the recording is available immediately after the event as well. So if you want to share it out with your networks right after the event, you can. Okay, so we'll go live on SciStarter and All of Us California. All right, we are cross-posting too. So this event is now officially live on Facebook, on the SciStarter Facebook page, on the NNLM All of Us Facebook page, and on the All of Us California Facebook page. So if you want to find the recording of this event afterward, you can look at all of those places, and we'll also email it out to all registrants on Zoom. We're going to get started in just 1 minute. While people come in, if you want to let us know in the chat where you're calling in from, that's always fun. It's always nice to see some geographic diversity. And you can just say hello in the chat, tell us something you're excited to potentially learn today. If you already have a question, go ahead and put that in the chat too. We just really want to hear from you. And we'll also be monitoring the Facebook live stream as well. So for those of you who are watching live on Facebook or you're watching the recording later on, don't be shy about getting in touch with us in the comments because we want to hear from you and respond to you and make sure this event is for you. Looks like Linda, she's just put in the chat, she's calling in from California. Hey, Linda, thanks for being here. Feel free to say hello in the chat. We're going to go ahead and get started. So I'm just going to get my screen shared. So before I introduce our panel, I have a quick blurb about Citizen Science Month. It kind of works as an icebreaker as people just filter on in. So hello, I'm Caroline. I'm your host for today. I'm with SciStarter. We're a global citizen science organization. I really view it as a privilege to work with the network of the National Library of Medicine and the All of Us Research Program during Citizen Science Month, which runs all through April, to put people in touch with real science they can do and ways that they can be a meaningful part of the scientific enterprise and create new knowledge about the world. So what is citizen science? At SciStarter, we work with people who call it different things: citizen science, community science. We've even worked with people who call it neighborhood science. Ultimately, our main concern is that people are doing real science. We think of it as a collaboration between scientists and those of us who are curious, concerned, and motivated to make a difference. Or another way we say it at SciStarter is citizen science allows anybody and everybody to turn their curiosity about the world into real scientific impact. Often this can be by collecting or analyzing data for researchers. And a really exciting project that we're highlighting today is All of Us, and you'll hear about that in a second. But there are over 2,000 projects, events, and tools listed on SciStarter. SciStarter is a global citizen science hub. You can participate all year long. Citizen Science Month, which runs during April and is part of this event, is really just an excuse to celebrate. But you can find astronomy projects, you can find biodiversity projects, you can find even more health projects. Anything you're curious about in this world, you can find a way to be meaningfully involved as a citizen scientist. You can collect data, analyze data, and what is data? It's just information. It can be words and pictures. It can be numbers that maybe you are monitoring the temperature of your local area for a climate scientist. Whatever it is, you can participate and make a difference with citizen science. And like I said, it is Citizen Science Month, and that's part of why we're doing this event. I wanted to give a shout out to, there are many partners around the world that make Citizen Science Month happen, but in particular, Arizona State University, as well as the network of the National Library of Medicine, are pivotal in the All of Us research program in terms of supporting people who are just really excited about citizen science and who help other people discover it as well. And events like this one, which are completely online, events that might be a hybrid of the two, events that are in person. It's just a way for, it's like the Super Bowl meets Christmas all month long to do citizen science. You can find even more resources at citizensciencemonth.org, including some resources if you want to host an event to educate people about All of Us or other projects. You can go to citizensciencemonth.org. You can also find our calendar there. There are more events in this series that we're doing with All of Us California that are listed on the calendar as well, and we'll be emailing those out afterward too. And some featured projects too throughout the month that allow you to gather light pollution data, help researchers predict the next outbreak of influenza, projects where you can design RNA molecules to help scientists develop RNA-based medicines, and so much more. It's really, really exciting. And you can find those featured projects at citizensciencemonth.org, as well as at scistarter.org/NLM. So it is April, it is Citizen Science Month, and you are here for a special event. This event is being recorded, so if you comment on Facebook, we might read out your comment. If you comment in the chat on Zoom live, we might read out your comment in the chat. We also really want Q&As from you, but because this event is recorded, it's also available after the fact, so share it with your friends and family. And today we have a panel of scientists from across generations who are going to speak to how scientists can collaborate, how the All of Us research program is a part of this. So I'm really delighted to host them. I'll be moderating the conversation, but we want you all to be part of the conversation too. But first, let's start with some introductions. So I think we'll pivot it over to Dr. Mendoza, if you could introduce yourself, and then we'll get to the rest of the panel.
Thanks, Caroline. So I'm Martin Mendoza, and I serve as the Director of Health Equity for the All of Us research program. I'm delighted to be here.
Thank you, Dr. Mendoza. And then we got Dr. Farias.
Hi, thank you, Caroline. My name is Albert Farias. I'm an assistant professor in population and public health sciences at the Keck School of Medicine of USC.
Fantastic. And then Dr. Diggs Young.
Hi, everyone. I'm Dr. Diggs Young. I'm the Assistant Director for the Office of Access and Inclusion at the Donald Brien School of Information and Computer Science at the University of California, Irvine.
Awesome. And last but certainly not least, we got San.
Hi, everyone. Welcome. My name is San. My full name is Sangeeta Agarwal. I go by San. You can follow me on social media at San Helpsy. I'm the CEO for Helpsy and Helpsy Clinic, which navigates people through their cancer and serious illness journey. And I'm also a PhD student focusing on digital health, especially using chatbots for healthcare.
Wow, this is quite the panel. And for those of you who may have never really even thought about science before, our research, don't be intimidated. We are going to have a very accessible conversation for you that I think anybody could learn something from. But first, we want to talk about what All of Us is. So I'm going to launch a quick poll. I want to know from our attendees if you know what All of Us is. No shame if you don't. That's why you're here. You're here to learn. If you do, great. You definitely have something you can learn here too. And if you're watching on Facebook and you can't vote in the poll, just let us know in the comments. Do you know what the All of Us research program is? While you get your votes in, I'm going to pass it over to Dr. Mendoza. Dr. Mendoza, can you tell us a little bit more about what the All of Us research program is?
Yeah, absolutely. Thanks, Caroline. So the All of Us research program is really this historical effort that's inviting at least 1 million members of the public who reflect the diversity of the U.S. From all walks of life to join the program. And so really the overall thinking behind the program is that historically, many communities, many populations have been underrepresented in biomedical research. So we're talking not just racial ethnic minorities, but sexual gender minorities, those who live in rural communities, persons with disabilities, those with lower educational attainment, lower incomes, challenges to accessing healthcare, and many others. So all these populations, have traditionally been underrepresented in biomedical research. And so you may be thinking, okay, underrepresented, but why is that an issue? The issue is that when you get the medical products that come from that research, so the drugs, the new pharmaceutical products, new vaccines, new medical devices, if if that research doesn't include those communities, then the resulting products, they may not work as well, or they may not work at all for those populations that were not included. And so how can we truly hope to be an equitable society where everyone has access to great healthcare and great medical products if those things are only working for a subset of our population? And so really, all of us was designed to address this issue. And so the goal of the program is to include everybody in this research endeavor. Therefore, the name All of Us. And so really, what we want to do is we want to accelerate medical discoveries that help everyone as individuals and get rid of this sort of this one-size-fits-all approach. So that's sort of the big overview, the 20,000-foot view of the program. Of course, I'm happy to answer more detailed questions as we go along. But thank you again for allowing me to be part of this panel.
Thank you. Yes, and for anyone who has questions, go ahead and get those in the chat and are in the Q&A. And I know we have more to talk about with all of us throughout the panel for sure, but I'm going to go ahead and end this poll, and I'll share those results. So it looks like 86% of the people attending know what the All of Us research program is, and only 14% of them don't. So but we do have some folks who don't know, which is great. They are here to learn, here to potentially get involved. And I see some questions coming in. We'll get to those in a little bit. That's great. Okay, so I'm also going to throw up another poll. For those of you who don't know what it is, if it's okay for All of Us California to get in touch, just let us know via this poll that I put up. But I think I'm going to go ahead and get to our first question on the panel. So part of the reason I think why you all do what you do is you're really passionate about it. So maybe we can start with you, San. If you could tell us a little bit about why you're passionate about science research, especially as it pertains to health.
Yes, thank you so much, Caroline. So I think for me, it's a personal journey on why science is so important. I came from a very humble traditional background in India, living in a village where women, girls were almost considered a property of the family and got married, and there was a very strong cultural influence. So I wanted to understand how world works, how things work, and how I can make an impact. So for me, education and learning and understanding why things work the way they do, how do they work things the way they do, what can I do to make it better, has been the driving force for me. Seeing the suffering in healthcare for individuals, and then learning how those things can be improved. Do we have any information that can help people to have better outcomes? That's what drives me. When I think about my Eastern and Western medicine background, I'm a nurse, and I'm also a Ayurveda practitioner and researcher. I think about the role of science very strongly, because there is a very strong cultural component to the tradition and the things that have worked. And perhaps there is a lot of evidence behind it. At the same time, there may not be. So I try to look at things from that perspective, from a scientific perspective, and see, can I validate this with data? Can I validate this with research studies, RCTs and systematic reviews, or can I validate this with simple case studies, so that I can evaluate whether this is relevant in how I care for my patients. I'll give you one quick example. So in our traditional medicine, we use turmeric and other herbs as antimicrobial. So many years ago, when I was a student, I actually did a plating experiment with microbes to see if those herbs work in creating the zone of inhibition, like they actually kill the bacteria. And I found that some of them do, and others don't. And then I learned the mechanism why. At the same time, I came across other examples which were based on culture, but I didn't find scientific relevance to it. And then over time, I actually learned that they were more politically based, cultural traditions that came up. So it helps me to care for people, and to also be evidence-based and fair in how I'm educating the next generation.
That was really inspirational. Thank you for sharing. Awesome. Dr. Diggs-Young, why are you passionate about science research, especially as it pertains to health?
You know, it's nothing I really just kind of grew up with. I've just always kind of been a little bit geeky and just really loved the world of science. I started off as a math and science teacher. It was just something that I gravitated to when I was younger. And then from there, you know, I decided to go either one or two paths. I was either going to go down the straight science path, or I was going to go down kind of the educational science path. And I took the educational science path, which is what kind of really opened up a whole new set of opportunities that I never thought were possible. You know, it led me to being able to work with students that are going into genomics and genetics and engineering, and how now all of these things are being combined. And so, as I consider myself more of a social scientist now, more than the actual kind of the more traditional sciences, I just find myself just growing in it and just enjoying it for the love of it. I guess I just love the science of science is how I can say it now.
That's awesome. Thank you for sharing. Dr. Farias, what about you? Why are you passionate about this work?
Yeah, thank you for the question. Much like my colleagues, my passion's really driven by my life experiences and my education. And so I am a first generation college graduate and a Latino researcher. And so early on in my education, when I was an undergrad, my mother was diagnosed with breast cancer when she was 37, and she was uninsured. And you know, we had to really navigate the system of trying to get our insurance access and trying to find the right treatment and the right doctors. And so there were numerous delays in her treatment. And I don't think that she received the treatment that she should have. And so, you know, this really sparked my interest in cancer health disparities, in trying to understand why certain populations, whether by race, ethnicity, or insurance status, receive different treatments when we know what works. And so my research goal is really centered around healthcare equity for patients diagnosed with cancer. So what does that mean? To me, health equity is more than everyone receiving the most effective treatment. And more that it's done in a way where those populations, underserved minority populations, those on public insurance, get the necessary resources to ensure that they have the most effective treatment. So we know very well that underserved minority populations are less likely to get life-saving and effective cancer treatment compared to non-Hispanic white patients. And so my research really helps us understand the multiple causes of these disparities so that we can address the main issues. I think that if we can do this, and if we can do this effectively with the research, we could eliminate most of the disparities that we see in cancer mortality, race, ethnicity.
This is so exciting. Thank you for sharing. And then Dr. Mendoza, bring us home with this question. Why are you passionate about the work you do?
Yeah, thanks, Caroline. So I really want to build on what Dr. Farias just said, and please feel free to correct me if I'm mistaken, but Dr. Farias, but I believe a lot of what you were referring to was the difference between equity and equality. And so, you know, for the audience, what that means is that, you know, equality, as Dr. Farias was just talking about, means treating everyone the same. But that's not always good enough, or it's not sufficient. You know, equity is the recognition that there are some populations, through no fault of their own, will be required, they will require additional resources, additional attention to ensure that they get the same good outcomes as other populations. And so that's really, I think, a key driver when we talk about health equity. And when we think about health disparities, for example, so to get your question, Caroline, about what drives me, you know, I come from a predominantly Hispanic background, and so both of my both of my grandfathers were double amputees from diabetes, despite following all of their doctor's recommendations and taking their medications as prescribed. That still wasn't good enough for them. And that gets back to, medications not working as well for some as it does for others. I have over 50 members of my extended family that suffer from diabetes, and I lost my mother to a cardiovascular health disparity. So for me, it's really personal. So that's why the All of Us Research Program is so important to me, because it's really getting at at this goal of achieving health equity, of achieving precision medicine, so that everyone can have great outcomes with their medical care.
Definitely. Yeah. Health disparities are, I think, a really important thing for us to talk about in this panel. In relation to, maybe Dr. Mendoza, we can stick with you for a second for this next question. So in relation to how you see yourself as a scientist, is the fact that you've grappled with health disparities in your own life and in your family's experience, does that shape how you see yourself as a scientist?
Yeah, absolutely. So I think, as I see myself as a scientist, it's a really a core part of my identity, of wanting to understand both the biological factors of health. So when we think about genetics, biology, and how that really interplays with what many people have termed, and what I'm sure a lot of people here have thought about, the social determinants of health. So where that affects your environment, your access to housing, your income, the various environmental factors around you. So how all of that plays together, is really a way to view a complete picture of health. And you really can't have one without the other. It's not just social determinants of health or biological determinants of health. It's really both, and how they interact with each other. And so really that together really helps me it really informs how I view myself as a scientist, and more importantly, how I can use my training and expertise to advance this field of health equity, so that we can achieve the highest level of health for everyone.
Fantastic. Maybe Dr. Diggs-Young, you can also take this question about seeing yourself as a scientist, because I know you mentioned you're a lifelong geek. How did your science identity, how did you shape that?
So similar to a lot of the other panelists, I grew up as a man of color. I'm a BIPOC individual, and scientists. We didn't see a lot of scientists that look like me at all, and identify as mixed race as well as Black and Korean. And so to see anyone mixed race, let alone anyone Black, was really not something that stood out for me. But for me, that was never really something that was the bigger issue for me. Was the fact that we weren't there. For me, it was understanding why we weren't there, right? Understanding what was the limitations, why were things set up. And so it took me from, starting off in the regular sciences, as we would, think about it, to going down towards like the social sciences of understanding how, race and ethnicity and, equity and equality, belongingness, identity development, how all of those are interacting with, why are we not getting responses when we have all of us and we're trying to get more people involved? And, where's the misjudgment coming from? And why are the practitioners not, able to communicate all of these results to all of the individuals that are receiving these, the counseling and whatnot? And so it took me down that path. And so I see myself in it because I am the recipient of it, right? My family is the recipient of it. I have parents that, when they get diagnosed with cancer, or when they get, diagnosed with, certain other diseases that are considered hereditary for, people of color. And you're like, well, is it, as we talked about, Dr. Mendoza talked about the social determinants. Is it hereditary because it's actually a biological thing, or is it hereditary because we are creating these systems and these communities in these areas, and there's all these interacting factors that are going on that's keeping us, in these certain spots, or allowing these certain, diseases to continue to develop. So I've taken that approach to just really thinking about, science and how we use this data and how we are, building this up. And so I see myself as how do I manage this science identity? Because I'm doing the work for the community that represents and looks like me. And that community is just as important. In multicultural education, when we talk about culturally responsive teaching, one of the things we say is that we are bringing in identities to the classroom and putting them at the forefront instead of having people's, diverse identities being at the back. And so when I see myself as a scientist, I'm bringing all of the identities I represent, all of the identities that are not being represented historically, that are not being, considered or and the ones that are not actually contributing because of all of the historical damage that has been done. So I see myself as a mediator, as someone who is working to make sure all of our data and all of our backgrounds are being included, not only in conversation, but in how we are, discussing and being talked to about what's being learned.
Definitely. And as a follow-up question on that, you mentioned, communities not wanting to participate in All of Us. And I know we have some people watching live who hadn't heard about All of Us before this event. So what would you say to those people about the value of getting involved in All of Us?
Well, there's part of it saying like, oh, what do I say to everyone else about why they should be involved? But I also bring the question back to ourselves working in this field. What are we doing to make sure that we're developing that trust? So individuals from communities that don't get involved feel like that they can trust what's going on. So I don't necessarily want to blame the victim for not being participating. What I really want to say is I think we all need to work together to recognize, that this is not I'm not involved because I don't agree with you, or I'm not involved because I just don't want to do it. A lot of it is I'm not involved because you're not telling me what I need to hear. You're not assuring to me as someone who might be part of a community that's not involved. And so that practice, that resolution can't just happen on let's convince one to join. That has to be a resolution where we're saying we're going to try to convince you to join, but we need to show you why it's important. And we need to say why it's important in a way that you understand it, right? We need to be able to have this culturally responsive way to engage with individuals. So I kind of take a different approach when I see that, because it does change how we are thinking about working with individuals and communities that aren't traditionally involved, because there's reasons that they're not. And that's a better question to ask is how do we address those reasons? Because they're very valid.
Definitely. And I'm abandoning the question list, but I want to open it up to the whole panel. The question Dr. Diggs-Young just asked, how do you build that trust? Anyone who wants to take that is welcome to. Dr. Mendoza, go for it.
Yeah, so I just want to echo what Dr. Diggs-Young just said. It's about building that trust and providing information to communities. I will before I get into how to do that. I will say that I think to take a step back as to the importance of why communities need to participate in biomedical research. So for our attendees here, I would ask you to think about all the various medications that you have taken throughout your life, both prescription and non-prescription medications. And if you were to look at before those medications were allowed to be sold from your local pharmacy or local CVS, what have you, they had to go through an approval process by the Food and Drug Administration, the FDA, and so that approval process typically requires what's called a clinical trial, which I'm sure most folks here are familiar with. What you may not realize is that for the overwhelming majority of these clinical trials that are done, They are conducted, the folks that participate in them are predominantly over 90% of European ancestry. And so what does that mean? That means that when we think about who those new medical products are going to work best for, it's going to be predominantly those of European ancestry, because they were the ones that participated in the research. And so you may be thinking, well, I don't want to subject myself to a clinical trial or clinical research. But the fact of the matter is, when you take that approved prescription or non-prescription medication that you buy at your local pharmacy, you almost kind of are participating in clinical research. Because if you're one of these underserved populations, if you belong to one of these populations, then you're kind of doing a clinical trial of one, because the manufacturers don't quite know how it's going to react in persons that were not in the original research, and so it may be just fine, or it may not. And so in the event that it's not fine, then you report it to your doctor or whoever, and that information is shared back with potentially shared back with the manufacturer. And so so that's how you're sort of participating in a clinical research after the fact, but without any of the protections of a clinical trial. So when clinical trials are formally conducted, there are many protections in place that dictate how the trial is run and to prevent harm to anyone that participates. And so you get those protections when you formally participate. But if you wait until afterwards, then you don't get any of those protections. And so, I'm not saying you should join every clinical trial possible, but you should really think about, for your specific case, what does and does not make sense. And now to get back to your original question, Caroline, about how do you build that trust within communities so that they can participate in clinical research? Well, of course, it all starts with information sharing. And one of the ways the All of Us Research Program does that is through using trusted voices in the community. So All of Us does not presume to think that we know what every community needs or needs to hear or wants to hear. And so we partner with local voices in the community that know the community the best, and we let them be our guide to telling us how we should interact with that community. And keep in mind, every community is different. So, this requires a lot of different partnerships, but for all of us, it's really worth it, because we want communities to feel comfortable joining this program, and so building that trust and doing it through the trusted voices and those who know the community the best is really how All of Us engages with the various communities throughout the United States.
That's fantastic. And I see that San, you have your hand up. Do you want to take that question as well? How you can build trust?
Yeah, I think that's such a beautiful question, and I would I think mirror what Dr. Diggs said first, is about how can we create that culture of trust with the community, and then invite the community. So when I think about South Asian in healthcare in US, that's a minority. And I think whether people feel safe, whether they feel included to be who they are and bring themselves as who they are, instead of being considered as a token representation. We got one of South Asian and one of Spanish and one of Black or whatever, right? So instead of being considered as a token representation, they're actually considered as an individual who brings that rich culture with them, and they are accepted for who they are, and their opinion, their value, their background matters. I think it's important for organizations to have clear policies that ensure that people from different backgrounds are not marginalized or not mistreated in any way. And then if anything does happen, then there are actions taken to ensure that people feel safe and people are not harmed, because that's what will build trust and will prevent people from feeling that bad things happen, right? So I think that at an individual level and at an institution level, I think that is the basic premise for creating that culture of safety and trust. And then I think as we then think about logistics of how do we build that culture of safety and trust and involve people, I think one thing we can think about is language barriers. So if we think about South Asian community or Spanish community or any minority community, people have their own languages. So if we want to bring people from different cultures into our research, we need to have materials in those languages. We need to do outreach to those communities to bring people from those communities. We also need to understand their traditional beliefs. Like, Indian culture, we have our own Ayurvedic and yogic culture and medicine, traditional medicine, homeopathic medicine. Similarly, Chinese has very strong with traditional Chinese medicine and acupuncture, things like that. So are we understanding the culture and the background that they're coming from for healthcare? Are we incorporating that? Are we respecting that in how we are providing healthcare to them or how we are conducting research? So instead of saying, don't do any of this, maybe we need to think about, is there evidence behind using something that can harm the individual? Then we can say, there is this evidence that says don't use this for this time while you're doing ABC. And these are the things that are either harmless, or these are the things that are from your culture, your background, that are actually positive and effective. So how do we bring that into the work that we are doing? And then how are we increasing representation of people from those different backgrounds so that they feel that there's somebody who's like them that they can talk to, and they feel safer in that environment, and feel like they belong, instead of feeling like they're in a foreign environment. I think that's some ideas around what we can do. I'm sure our participants have a lot of ideas and thoughts around it as well.
Yeah, definitely. I'm hearing a real theme of voice, like what Dr. Mendoza mentioned, like working with trusted community members, or Stan, what you just mentioned, like even, materials in people's languages are materials that honor people's cultural beliefs about health. Dr. Farias, would you like to take this question as well about building trust?
Yeah, absolutely. So I think, I just want to, before I get to that, just reiterate how important it is to have representation in research. And, my research would not be possible without the participation of minority populations. So the very nature of my research as a cancer epidemiologist is to look at differences and identify disparities and study health equity. And if there's not enough participation, it's hard to identify what some of those factors might be. And I think the panel has mentioned a lot about participation from racial ethnic minorities, but I think that there are other populations that also are really, really important, and that I also want to stress the need for more participation, especially the LGBTQI plus population, more underserved populations, by household income, et cetera. So all of these populations are so important to participate in the All of Us study. And so in the All of Us data research. And so how do we do that? We've all mentioned trust. And I think another way that we can build trust is to have more representation from researchers who are actually going to use the data. And so all of us on the panel represent a population. And I think that in order to get populations to trust the All of Us data research study is to have researchers who are going to answer important questions that are answerable to them. And so if I could just get back to that question on, building identity, I think, there may be a lot of aspiring scientists or scientists here who are on the call, who are on the listening to the presentation. And I think mentorship is so important, and receiving mentorship from scientists is so important. So I developed that through mentorship. And so if you are a scientist or a current scientist, I want to encourage you to find a mentor who encourages you to find your identity, to identify your scientific and personal goals, and who supports you in achieving them. Even at an early age, when I was in high school to now, after having served as an assistant professor for 6 years, I have mentors who provide these to me every day. And so lastly, as a minority scientist, I think it's important to seek out and find mentorship from other underrepresented minorities, because we often share similar life experiences and similar challenges and passions for research. I serve as the co-director of the PhD program in epidemiology at USC, and I think one of the things, one of my personal goals, aside from the science, is to also mentor the next generation of researchers. And so I think that that's so important in building the aspect of trust for people to see people that look like them actually conducting the research.
Definitely. And that actually gets at one of the next questions about scientists working across generations. But first, I want to see if Dr. Diggs Yong has anything to add. I think you're on mute.
Yeah, I just wanted to add, as the rest of my colleagues that have said some incredible things, but I just wanted to kind of loop back real quick to just mention something about the information sharing and everything that we said. One area that I think is that we are starting to be on the cusp of is this idea of intersectionality. And right now a lot of times we're thinking in terms of more, if we are thinking biculturalism in terms of like American Indian or American Korean or whatever hyphenated identity that you have, that's one part of, in biology, it might be a little bit easier to think about it in terms of that. But when we're getting into intersectional identities, then as well as me being biracial, there are things that just, really create a whole different need for why we need individuals to be involved. For example, when I go into the doctor, my doctors will, as a baseline, treat me as if I am a Black male, without even recognizing that being a mixed male, having Korean and, Black biology, that it could be the other versus the one that they're treating. So, think about intersectionality in terms of race, thinking of biological intersectionality, thinking about identity and intersectionality as we're moving forward. That is going to have to challenge us to talk about when we're information sharing, when we're giving, results back, how are we making sure we are accounting for that too? So, and that's also going back to what Dr. Ferris said, is that's part of the excitement of being in this field, right? We look at my advisor told me, she said, when you do research, you're researching yourself, right? There's something connected to you that impacts why you do the research. And I think we all fall into that category.
Definitely. Intersectionality is such a powerful theme. It's when people's identities intersect. And the different factors that may be at play because of those intersecting identities. So that's a really fantastic thought. I want to go back to Dr. Farias for a second, because you mentioned mentorship. I feel like science and research have changed so much, even in just the short amount of time since when I started trying to earn my PhD. So I'm curious how you think, and with the theme of mentorship, how scientists and researchers can work across generations to accomplish this important work.
Yes, mentorship is so important. And, I often tell my PhD students that you don't only have one mentor. right? There are many, many mentors, and you get different skills and things from different mentors. And so sometimes you need a mentor who's just going to cheer you on and celebrate everything you do. Sometimes you need a mentor who really relates to you and connects with you on a personal level. And then you also need a mentor who's really going to challenge you and challenge your way of thinking, to push you and stretch your knowledge, and to identify areas in your training that need to be strengthened. And sometimes you get lucky and find that all in one person. Sometimes we have a whole army of mentorship. I think mentorship also comes from your peers as well. And so mentorship is so important in pushing us all to be better researchers. And so you know, I encourage senior faculty members or senior researchers, all the way to people who just have an interesting question, right? As a scientist as well, to partner together, because I think that's where the innovation comes from, where people are working together in a mentorship capacity, but also in a very collaborative way, to ask those important questions that haven't been asked before.
Definitely. And Dr. Mendoza, I'm curious what you think about this topic, how scientists can work across generations and researchers can work across generations towards building a more diverse and inclusive science community, and also accomplishing important scientific work.
Yeah, you know, it's absolutely critical to have that sort of cross-generational, cross-discipline sort of mentorship and collaboration. You know, it's really the beauty of science, because, you know, when your colleagues on one side may not be thinking about things the way that you may be thinking about, and so really reaching out to them and you know, engaging them in your research is really super critical. And for the younger scientists, you know, in the group, I would also encourage them to be bold and proactive, and reach out to folks that, you know, you think may have never heard of you, or probably haven't heard of you, and they're so above you that you wouldn't even know what to say to them. But I would still encourage you to reach out and introduce yourself. And I think more times than not, what folks will find is that these senior folks are often very excited and eager to help the younger generation, because I think they fully realize that you know, having that sort of collaboration across disciplines, across generations, is really critical to the future of science. And so without that, you know, science doesn't advance. So I would encourage folks, especially younger scientists, to be bold and really to reach out to not just your colleagues and peers, but to those above you, and to serve as mentors for the younger generation too. You know, there's lots of things we can all teach each other.
Definitely. I see San has her hand up. If you want to add anything to that.
Yeah, I think that's such an important question. I think about the times we are in today, in the age of AI and you know, ChatGPT, and the development of these models that have now become public. I cannot think of a more important, you know, time for us to seriously be thinking about cross-generational research and incorporating that, because essentially AI learns from data and the models. So it's like the recipe for the cake and the ingredients in the cake. If our voices, our data, and the way we want it represented is not included, then that's what is getting baked into this cake, into this model. And now it's not just, you know, what each healthcare professional is learning or how they are working. If these models are, you know, AI is helping millions of people, then, or it's impacting the care of millions of people or billions of people, then it'll get escalated at that level. So if we do something good, we can amplify it at that level. If there is a problem, it'll also get amplified. at a massive level. So I think cross-generational research and incorporating who we are and what's important for our community, like what Dr. Mendoza talked about, Dr. Diggs talked about who we are and how we represent ourselves, how do we see ourselves, bringing that is so critical. And I also want to add that, sometimes it might feel intimidating, like I used to think about it, say, oh, maybe it's not me, I'm nobody, or, I'm too small of a fish to be able to make a difference. But the reality is that when we are trying to make a change, when we're trying to do something, it's innovative, it's new, we need all hands. Sometimes, there are just so many different ways to contribute. So if you just have passion for something, you believe in something, just show up and just say, I believe in this and I want to help. And you learn from that process of helping and from serving on the mission together, you get mentored in the process itself. And you're bringing something of yourself to be able to make a difference. Like, when Cancer Moonshot happened, I just was helping. And then over time, those initiatives grew and that became Cancer Moonshot. There was the 21st Century Directive, there was palliative care initiative, where we were talking about education, like education for palliative care for healthcare professionals. And that over time became an act, Pachita Act, which got signed. And, now there is palliative care education. So a lot of things like that, like, you show up and then, you just do what you can. And sometimes those movements take off and become something really that can actually make a difference. So that's how I think about contributing to this cross-generational piece.
It's fantastic. And I think that's actually a really good segue, because we're getting some questions from people who are watching about how do I participate in All of Us, or is All of Us a randomized controlled trial? You mentioned making a difference. I think the cool thing about citizen science and the All of Us research program is you don't have to be a professional researcher or a scientist to make a difference. So maybe Dr. Mendoza, if you want to take this one, how can people get involved with All of Us and make a difference?
Yeah, so thanks, Caroline. So you make a difference simply by getting involved. So that's the obvious one. As far as how to get involved, there are several avenues available. You can, All of Us is partnered with certain healthcare provider organizations. So you can certainly join through that method. You can also join by visiting joinallofus.org. So that's another option. And then we also have our what we call our mobile engagement assets. That's what we call internally, but they're really our traveling vans, our traveling trailers. There are 3 of them, one for the East Coast, one for the West Coast, and one for the middle of the country. And, so these are large trailers that travel north and south, east and west, all across the country to various places. And there you have the option to learn about the All of Us research program. And if you decide you want to join, you can join right there. You can go through some of the various, you can go through the consent process. You can fill out some of the basic surveys. You can donate. So one of the core parts of the All of Us research program is donating blood at your choice. So you can donate a biosample, so blood, urine, or saliva. You need your physical measurements taken. So your height, your weight, your blood pressure, things like that. And these are all things that are part of the All of Us research program. It's important to note, however, that to join the program, you don't have to do all of them. In fact, you only have to do the ones you're comfortable with. So we really believe in giving people a choice here. Of course, if you want to receive things like your genetic ancestry or your hereditary disease risk report, say a certain gene may be predispose someone to a certain condition, those things all require biosamples, so primarily blood. So in order to get those, you do have to donate a biosample. But again, we're happy to take whatever data if you decide to join, that you may want to offer. So if you just feel comfortable filling out surveys, that's perfectly fine too. Again, the choice is everyone's to make.
Fantastic. And that leads me to one of our final questions. So after people get involved and they participate, what's the impact of it on y'all's research, on the work that you all do? So open question to the panel, whoever wants to take that one first. What's the impact of all of us on the work that you do in your research? Whoever wants to take this one first, go for it. Okay, go for it, Dr. Mendoza.
I'll take it. So the important thing to note about all of us, the research program, as I think Mr. Campos noted in the chat, is that it is not a clinical trial where you have an intervention. What it is it's a database, and so what you're doing is you're contributing to a health information database with your information that is anonymized, de-identified, and so when all this information is gathered into this database, again, and personal identifiers are removed from it, it is then curated and shared with approved researchers that have been through a vetting process so they can do the research. The All of Us Research Program is a platform, for researchers to answer questions about their disease or condition of choice. So by joining this database, which will be one of, if not the largest of its kind, you are ensuring that any research and any medical breakthroughs that come from that research, that your information, obviously, of course, de-identified, is helped to inform that research, and therefore the medical product has that much of a better chance of being relevant to you and people like you.
Fantastic. Dr. Diggs-Young, do you want to add anything to that?
Yeah, I'll add. So for the work that I do, especially around identity development, the All of Us research really helps me to understand how individuals develop their identity. And so I don't look at the biological part. I look at the social impact of what happens when we identify ourselves. So just to share out, if some examples of books that have really highlighted this, of The Social Life of DNA by Alondra Nelson, talks about what happens when that DNA is received and how it impacts us socially. Dorothy Roberts' Fatal Invention, Stephen Gould, The Mismeasure of Man. All of these things are kind of in that realm of, okay, now that we have this, how is this shifting our society? How are we shifting our identities? How are we shifting how we identify, where we came from historically? Especially, for African Americans, where a lot of our history has been just, wiped out. And so I really, the All of Us research has really been impactful in influencing a lot of authors and scientists around looking at how this biological and genetic data is influencing us and changing our outlook of life socially through that. So again, happy to drop the name of those books on there if you're interested, but that's how it works with me.
Yeah, we'll put those in the follow-up email. Thank you. Dr. Farias?
Yeah, so I just want to mention briefly, a lot of what my research has been able to do prior to the All of Us is to look at things kind of in a vacuum, right? Like one factor by race, ethnicity. I think the All of Us data is so comprehensive. It includes, wearable activity tracker data. It includes data on, biological data from the biospecimens, data from electronic health records, from extensive questionnaires. And so it allows us in a single study to look at the contribution of all of these factors to health and health outcomes and eventually how to improve it. I think the thing that I'll mention that wasn't mentioned here is that, there may be a lot of scientists on the call, and depending on your level, all of this data is publicly available through the All of Us Research Workbench. And so that's how I access the data to look at unmet healthcare needs for cancer survivors. And so I just wanted to briefly mention that here.
Yeah, and is the workbench, that's accessible to everyone, right? Not just researchers?
Dr. Mendoza, do you want to answer that? My understanding was that it's accessible to anyone. You have to register. It does take a little bit of technological savviness, for lack of a better word, to get through and manage the data. But that's where the partnerships come into play with scientists and mentorship as well.
Yeah, so to access the data, you need to be affiliated right now with a research institution, generally a university, but there are others, because what's required is called a DURA, a data use and resource agreement. And so what that agreement lays out is, the conditions for the use, that the researcher will not do stigmatizing research, and a lot of other requirements. And then once that is in place, researchers will then gain access to the database per that agreement. We do hope to expand that to other entities moving forward, but right now that is the primary method of gaining access to the researcher workbench where the All of Us data lives.
Definitely, and that seems important for just as a protective measure to protect people's privacy. But for those who want to see the publicly available data, I know I personally have poked around the data browser, which is super interesting. It might be interesting for some folks on the call. San, do you want to add anything?
Yeah, I would say I think the work that all of us is doing and the data it collects is so important. And it's so important for all of us to participate because it allows an opportunity for researchers who want to research that area to represent you, to understand what your data is telling about a way a disease is progressing or how certain things are working. In my work, I'm a cancer nurse and a quality of life researcher. So in my work, I was able to do work related to breast cancer and representation of integrative medicine, representation of different cultures because of the data that I can get from all of us and organizations like All of Us. And when I think of building digital health solutions, I look at the social determinant of health data that All of Us has and what kind of resources are needed. Are we truly building solutions that are addressing the community needs, or are we just building something that might seem like a cool and shiny solution, but may actually not be addressing the need of all the community members? So the work that All of Us has done is what, the people who have contributed to the data at All of Us is what helps me to be able to contribute both to science and to the development of technology. I would add one more small thing is that, All of Us also has data about wearables and Fitbit. And, some of the work that I'm involved in doing or, starting to is in using wearables and digital health and devices. This data becomes so important in understanding what's the real world evidence, what are these sensors telling us, how is it different for different people, so we can truly build healthcare solutions that include the understanding of everybody. When we look at heart rates, when we look at different biometric measures, and how do you calculate risk, or how do you calculate something is working? So all that is so valuable that everybody is contributing. So I invite everybody to contribute, to be part of this organization. And I'm grateful for everything that I've been receiving from All of Us.
Fantastic. I know we're right at the end of time. That's a very good note to end on. I wanted to alert everyone to the survey in the chat. Also the link to join All of Us in the chat. For those I know some people haven't joined yet, or still hadn't heard of it before this event. So that'll be a resource for you, but we really would love for you to fill out the survey to get in touch with All of Us. I noticed everyone answered the poll about whether or not All of Us California could get in touch, which was great. While people are filling out this survey and heading out, I want to see if there are any final remarks from our panelists, anything you didn't get a chance to mention that you want to mention before we all go today. I know we covered a lot of ground, so it's okay if you covered everything you want.
I'll just say that it was a pleasure being here with my fellow panelists, as well as with all of the attendees, and that I hope everyone, if you're not already part of the program, will consider joining. I am a participant myself, as I'm sure many other folks here are. It's been a great experience, and but really knowing that my information is going to contribute to better health for everyone has really been the best reward for me.
Fantastic. Anything else from our panel before we go?
I would like to add something. So I'm still working on my PhD. It's something that I've been wanting to do for 20 years. So I'm not a scientist yet, or at least with a degree, but I do consider myself as a critical citizen scientist. So one thing I would say is, when you look at something, because we get so much data now from all places, even when we are looking at social media, even when we're reading articles, even if we are listening to news, there is so much stuff, right? Think about that from a critical perspective. Think about that and see, can you back it up with evidence? Does this make sense to you? Does it represent you? And if not, then reach out to people, reach out and express your voice, because if you have that opinion, or you're feeling that it's, there is something to be said, something that's not representing you, I bet there are other people who feel the same way. So by you giving voice to your needs and your representation, you're also creating a platform, a channel for other people to show up and to be able to represent themselves. And everything you do adds value. I saw like integrative medicine work being done at NCI. There is a task force, and they didn't have a nurse on the panel. They didn't have somebody with Ayurveda background. And generally, without a PhD, you don't show up on those panels. But I said, do you want a nurse's opinion? Do you want somebody who has the Ayurvedic opinion on the panel? I'm still working on my PhD. And they said yes. And I'm the first nurse on the NCI integrative medicine task force. So you show up, and if there isn't a chair for you, you ask if you can, create a chair for yourself, because each one who's here has so much to offer. So just show up, just be yourself. And I hope all of you thrive as scientists, as researchers in what you do every day.
Fantastic. Dr. Diggs-Young?
Yeah, I just want to encourage all of you to be not only be critical, but be creative. A lot of times when we do science, we have a tendency to want to keep certain things in our field. But with all of us data research that's out there, we want to see how this data can be expanded and used in other ways than just within just the medical. Be creative. Musically find a way to take this data and create something expressive. Artistically, I do it within diversity and inclusion and social science. Theoretically, if you're in theater and you want to create some, be creative with it. Take this data and use it, because the more we expose it to different ways, the more we're going to get people interested in the data. And that's really what we want. And if they're interested in the data, they'll be probably just as interested to contribute to it, to be represented in that data. So be creative, don't limit yourself. And if you don't have the idea now of how you can be creative with it, just keep it at the top in the back of your mind. And when that opportunity comes, just jump on it.
All right. I can't think of a better note to end on. Be creative, get out there, contribute. And I want to thank you all again. Please make sure you fill out the survey. And we also have the joinallofus.org link in the chat. Have a good night, everybody. Bye.